One overlooked mineral could reduce blood pressure, relieve chronic pain, and even lower your risk of diabetes and heart disease. Millions suffer from conditions linked to magnesium deficiency, yet few are ever told. Could your symptoms be caused by this missing nutrient? Let's uncover the truth. Welcome to Levitas. Do you have any experience with magnesium supplementation? Leave a comment or question. And here are the 12 health issues. 1. Hypertension. Magnesium is one of the most powerful yet underused natural tools for high blood pressure. This mineral helps relax the smooth muscles in artery walls, lowering resistance and improving blood flow. A 2021 meta-analysis in hypertension showed that supplementing with 300 to 500 milligrams of magnesium daily significantly reduced both systolic and diastolic pressure in hypertensive patients. Magnesium also regulates calcium and potassium balance, critical for vascular tone. When magnesium levels are low, arteries can constrict and blood pressure spikes. Many people with uncontrolled hypertension are unknowingly magnesium deficient, especially those on diuretics, which deplete this vital mineral. By restoring adequate levels, magnesium improves the effects of antihypertensive medications and may even help prevent heart attacks. Foods like spinach, avocado, pumpkin seeds, and dark chocolate are magnesium-rich and heart-protective. For patients with stubborn high blood pressure, magnesium is not a supplement, it's a game-changer.
Low energy, belly fat, weak drive? Most men eat 5 foods that quietly destroy T levels. My free guide shows you what to avoid and what to eat instead to reclaim your health, strength, and metabolism. Backed by science. Built for men. Download it free now. Your body will love you. Link in the description.
2. Migraines. If you suffer from migraines, magnesium might be the missing link. This essential mineral affects several mechanisms involved in headache development, including neurotransmitter balance, blood vessel dilation, and inflammation regulation. A 2018 study in headache found that migraine sufferers had significantly lower serum magnesium levels, and supplementation reduced both frequency and intensity of attacks. Magnesium blocks NMDA receptors in the brain that are responsible for pain transmission, and it helps stabilize the brain's electrical activity. It's also known to reduce levels of calcitonin gene-related peptide, a molecule that spikes during migraine attacks. Certain types of migraines, including menstrual migraines, are particularly responsive to magnesium therapy. Supplementing with magnesium glycinate or magnesium threonate, which cross the blood-brain barrier, can yield noticeable improvements. Patients often report fewer triggers, quicker recovery, and more symptom-free days. For chronic sufferers, magnesium is not just helpful, it's liberating. 3. Osteoporosis. Osteoporosis is often blamed on calcium deficiency, but without magnesium, calcium cannot be properly absorbed or utilized. Magnesium is vital for the activation of vitamin D, which in turn regulates calcium metabolism. A 2020 study in the Journal of Bone Metabolism found that higher magnesium intake correlated with greater bone density in older adults. Magnesium also affects the activity of osteoblasts and osteoclasts, the cells responsible for building and breaking down bone. Without enough magnesium, bones become brittle, even if calcium intake is sufficient. For strong, flexible bones, magnesium is just as important, if not more so, than calcium. 4. Type 2 diabetes. Magnesium plays a central role in blood sugar regulation, insulin signaling, and glucose metabolism, making it a critical nutrient for those with type 2 diabetes. A 2019 study published in Diabetes and Metabolic Syndrome showed that magnesium deficiency is common in diabetics and is associated with worse HbA1c levels, more complications, and higher insulin resistance. Magnesium acts as a cofactor in over 300 enzymatic reactions, many of which govern carbohydrate metabolism. When magnesium is low, cells become less responsive to insulin, leading to hyperglycemia and further deterioration. Supplementing with 250 to 500 milligrams daily has been shown to improve insulin sensitivity and reduce fasting glucose. Magnesium also combats oxidative stress, which contributes to diabetic neuropathy and vascular damage. In both prevention and management of type 2 diabetes, magnesium is an evidence-backed and natural therapeutic agent that should be part of every diabetic care plan. 5. Muscle issues. Cramping, twitching, and stiffness? These are classic signs of magnesium deficiency. Magnesium helps regulate muscle contraction and relaxation by balancing calcium and potassium levels in muscle cells. Without enough magnesium, muscles stay in a state of partial contraction, leading to cramps, spasms, and discomfort. A 2021 article in Nutrients showed that athletes and older adults who supplemented with magnesium experienced fewer night cramps and better muscle recovery. Whether it's due to overtraining, dehydration, or stress, restoring magnesium levels can relieve symptoms quickly. It's also a must for conditions like restless leg syndrome. 6. Chronic sadness. Magnesium has a profound impact on mood regulation and may be a missing piece in managing stress and chronic sadness. A 2017 randomized trial in PLOS ONE found that daily magnesium supplementation led to significant improvements in sadness symptoms, often within 2 weeks, in people with mild to moderate sadness. Magnesium supports the production of serotonin, the brain's primary mood-stabilizing chemical. It also reduces inflammation, which is increasingly recognized as a driver of depression. Magnesium downregulates glutamate, an excitatory neurotransmitter that, in excess, can cause neurotoxicity and mood imbalance. Low magnesium has been linked to anhedonia, brain fog, and feelings of helplessness. Whether the root cause is stress, nutrient depletion, or medication side effects, replenishing magnesium stores often brings noticeable emotional relief. It's a potent tool for those stuck in the fog of low mood.
Want to burn fat and build muscle faster? I created a free science-backed supplements guide to boost your energy, fire up your T levels, and ignite your metabolism. No fluff, just results. Download the free guide now and start your body transformation today. Link in the description. This is how metabolic men optimize their stack.
7. Stress. Stress is often biochemical, and magnesium is a natural anxiolytic that regulates the stress response. It inhibits the release of cortisol and promotes GABA production, which calms the nervous system. A 2021 review in Nutritional Neuroscience confirmed that magnesium supplementation reduces symptoms of generalized stress disorder and panic attacks. When magnesium is low, the brain becomes hyper-reactive to stressors. Heart rate increases, breathing becomes shallow, and sleep is disrupted. Rebalancing magnesium levels helps break that cycle. It's particularly effective when combined with B vitamins and adaptogens like ashwagandha. 8. Fibromyalgia. People with fibromyalgia often suffer from muscle pain, fatigue, and insomnia, all symptoms associated with magnesium deficiency. A 2022 study in clinical rheumatology found that patients with fibromyalgia had significantly lower serum magnesium, and supplementation led to improved pain scores, sleep, and energy levels. Magnesium reduces NMDA receptor overactivity, which contributes to pain perception. It also helps regulate sleep quality and supports ATP production, which combats fatigue. Many patients report relief within a few weeks of magnesium therapy. Magnesium malate and magnesium glycinate are the most effective forms for fibromyalgia support. 9. Arrhythmias. Irregular heartbeats, or arrhythmias, can be triggered by magnesium deficiency. Magnesium is crucial for maintaining electrical stability in heart cells. It helps regulate calcium influx and potassium efflux, which control the heartbeat. A 2019 study in heart rhythm found that low magnesium increased the risk of atrial fibrillation and other cardiac arrhythmias. Supplementing with magnesium has been shown to reduce episodes of palpitations and improve cardiac rhythm. It's particularly effective when combined with potassium and used in patients recovering from surgery or under high stress. If your heartbeat feels irregular, check your magnesium. 10. Thyroid issues. Your thyroid needs magnesium to function properly. Magnesium supports the conversion of T4, the inactive thyroid hormone, into T3, the active hormone, that your body can actually use. A 2020 study in endocrine connections found that women with hypothyroidism had significantly lower magnesium levels. Magnesium also reduces autoimmune inflammation, often present in Hashimoto's thyroiditis. It assists with hormone receptor sensitivity, so your cells actually respond to thyroid signals. Without enough magnesium, thyroid hormone levels may look normal on paper, but symptoms like fatigue, weight gain, and brain fog persist. For thyroid health, magnesium is foundational. 11. Insomnia. Magnesium is your body's natural relaxation mineral, and one of the best non-drug therapies for insomnia. It helps regulate the production of melatonin, calms the nervous system, and enhances GABA activity in the brain. A 2019 clinical trial in the Journal of Research in Medical Sciences found that older adults who took magnesium slept longer and woke up less frequently. Magnesium also helps lower nighttime cortisol, reducing those anxious, racing thoughts that keep you awake. Taking 200 to 400 milligrams of magnesium before bed can drastically improve sleep onset, duration, and quality. It's gentle, safe, and incredibly effective. 12. Insulin resistance. Insulin resistance is a silent epidemic, and magnesium plays a key role in preventing and reversing it. Magnesium enhances insulin receptor sensitivity, allowing glucose to enter cells efficiently. A 2018 study in diabetes care found that higher magnesium intake reduced the risk of developing insulin resistance and metabolic syndrome. Magnesium also supports the enzymes that metabolize sugar and improves mitochondrial function, which boosts energy levels and reduces fatigue. People with prediabetes or PCOS often benefit significantly from magnesium therapy. It's one of the most cost-effective tools for regaining metabolic control.
Want to become a high-performance machine? Track your supplements, sleep, hydration, and fat-burning habits, all in one simple tool. This daily tracker keeps you consistent, focused, and results-driven. Download it free now and start operating like a metabolic pro. Real results come from what you track. Link in the description.
In conclusion, magnesium is more than a mineral. It's a powerful, natural ally for treating hypertension, relieving migraines, preventing osteoporosis, improving insulin resistance, and calming stress and chronic sadness. It supports your heart, muscles, thyroid, sleep, and mental health through mechanisms backed by science. When magnesium levels are low, the body malfunctions silently. Restoring this one nutrient can reduce symptoms most people treat with medications, without ever knowing the root cause is simply a magnesium deficiency. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.